Tinnitus and the masticatory system. The tinnitus and the masticatory system are closely interconnected, with dysfunction in the masticatory system often contributing to the development or exacerbation of tinnitus. The masticatory system includes the muscles, joints, and associated structures involved in chewing and jaw movement, particularly the temporomandibular joint (TMJ) and surrounding muscles. Understanding the relationship between tinnitus and the masticatory system is crucial for diagnosing and managing tinnitus effectively, especially in cases where temporomandibular joint disorders (TMD) or other masticatory system dysfunctions play a role. Mechanism of interaction. Dysfunction in the masticatory system, such as TMJ disorders or malocclusion, can lead to changes in muscle tension, joint alignment, or chewing patterns, which may influence neural activity and sensory processing in the auditory pathways. The close proximity of the auditory and masticatory systems within the temporomandibular region allows for bidirectional neural interactions with sensory inputs from the masticatory system, potentially modulating auditory perception and tinnitus. Neurophysiological mechanisms underlying the interaction between tinnitus and the masticatory system may involve central sensitization, altered neural plasticity, or shared neural pathways involved in sensory processing and pain perception. Temporomandibular joint disorders (TMD). Temporomandibular joint disorders encompass a range of conditions affecting the TMJ, including arthritis, disc displacement, myofascial pain, or joint degeneration. TMD may be associated with symptoms such as jaw pain, clicking or popping sounds in the jaw joint, limited mouth opening, muscle stiffness, and difficulty chewing or speaking. Dysfunction in the TMJ and associated musculature can lead to referred pain, muscle tension, or sensory disturbances that may influence tinnitus perception. Malocclusion and dental pathology. Malocclusion, or misalignment of the teeth or jaws, can exert uneven pressure on the TMJ and surrounding structures, leading to muscle strain, joint dysfunction, and sensory changes that may contribute to tinnitus. Dental pathology, such as tooth grinding, bruxism, dental trauma, or occlusal discrepancies, can also affect the masticatory system and contribute to tinnitus symptoms. Clinical manifestations and assessment. Patients with tinnitus and masticatory system dysfunction may present with specific clinical features, including changes in tinnitus pitch, intensity, or localization associated with jaw movements, chewing, or clenching. Clinical assessment of tinnitus and the masticatory system typically involves a comprehensive history, physical examination, and evaluation of TMJ function, dental occlusion, muscle palpation, and associated symptoms. Diagnostic tests, such as imaging studies e.g. MRI, CT scan, dental examination, electromyography, EMG, or bite analysis, may be indicated to identify underlying masticatory system pathology or related comorbidities. Management and treatment. Management of tinnitus and masticatory system dysfunction focuses on addressing underlying contributors and modulating sensory inputs to alleviate symptoms. Treatment strategies for tinnitus associated with the masticatory system may include TMJ therapy, conservative measures such as jaw exercises, physical therapy, occlusal splints, or orthodontic treatments to alleviate TMJ dysfunction, reduce muscle tension, and improve joint mobility. Dental interventions, dental occlusal adjustments, orthodontic treatments, or restorative procedures to correct malocclusion, restore dental alignment, and reduce occlusal discrepancies contributing to tinnitus. Muscle relaxation techniques, relaxation exercises, biofeedback, or trigger point therapy to reduce muscle tension, myofascial pain, or bruxism associated with masticatory system dysfunction. Behavioral interventions, stress management techniques, cognitive behavioral therapy, CBT, or mindfulness-based therapies to reduce anxiety, improve coping strategies, and modulate tinnitus perception. Interdisciplinary approach. Managing tinnitus and masticatory system dysfunction often requires an interdisciplinary approach involving collaboration among otolaryngologists, dentists, oral surgeons, physical therapists, chiropractors, and other healthcare providers. Comprehensive evaluation and treatment of tinnitus and masticatory system dysfunction should address both auditory and masticatory system contributors to optimize outcomes and improve quality of life for affected individuals. In summary, dysfunction in the masticatory system, including TMJ disorders, malocclusion, or dental pathology, can contribute to the development or exacerbation of tinnitus. Understanding the relationship between tinnitus and the masticatory system is essential for diagnosing and managing tinnitus effectively, particularly in cases where masticatory system dysfunction plays a significant role. By addressing underlying contributors and modulating sensory inputs, healthcare providers can help alleviate tinnitus symptoms and improve overall patient well-being.